Good day, everyone. Welcome to the module 13 in. And here we'll be talking about teeth and mouth care. In the previous module, module 13D, we discussed procedure on changing a clean dressing. But today we'll be talking about teeth and mouth care. So we know what teeth is, you know what the diagram or the picture, that's the teeth and the mouth. So the mouth encloses what? The teeth. So there is no way you would do a mouth care without a tooth care, and there's no way you would do a teeth care of the teeth without the mouth. So these two goes hand in hand. So without wasting much time, we'll move to the introduction to mouth hygiene. You know what is called mouth hygiene, oral hygiene? You know, we're talking about the same thing here. Now, performing or assisting with mouth hygiene is an important task for a home health aide or a personal care aide. Now, mouth hygiene should be performed at least twice per day. That means in the morning and in the evening. In the morning when you wake up and the evening when you are done eating for the day. So, mouth hygiene may also be performed after eating meals at any time that the patient requests. So regular daily flossing helps to remove the plaques and food debris which promotes bacteria from the patient's mouth. Unclean mouth harbor bacteria. We know what it feels like if you have someone whose mouth is smelling, how that smell feels like. So if your mouth is unclean, it harbors bacteria and it can make your mouth to smell. And this causes what additional problems for the patient. So having a clean mouth promotes a sense of comfort and also self-esteem for the patient. So this is an example of how a teeth or oral hygiene is being done. Brushing the teeth. So providing oral care also gives home health aides or personal care aides a chance to assess the health of their patient's teeth, of the gums, as well as the tongues. So the goal is not just to wash the teeth, but for assessment. So it's not only for washing, but also for what? Assessing. So home health aides or personal care aides should encourage their patients to perform such as much as what mouth care independently as possible. So we can assist them and also teach them how to do what? Mouth care. For patients who are unable to grasp the handle of a toothbrush, special toothbrush may be available for them. A split rubber bale or a tape can be used to build the handle of the toothbrush to make it easier for the patients to hold. And an electric toothbrush can also be used. So when washing the mouth of a patient, you avoid using hydrogen peroxide or alcohol-based products because this can promote mouth irritation and mucosal membrane breakdown. For patients in which using the toothbrush is unsafe, such as those who are unable to spit or those who are unconscious, special mouth swabs are available for use. Mouth care should be provided every 2 hours for patients who are unconscious or unable to what? To drink or to spit out. This helps to prevent dryness and breakdown of the mouth surfaces. When finished with providing of the mouth care, you apply a lip moisturizer or a petroleum jelly to the lips to prevent the skin from breaking down or chapping or maybe drying of the lips. So how do we perform, or the procedure for performing teeth or assistance in oral hygiene for patients who can wash their teeth, or patients who only need some assistance? The first thing to do is to explain the procedure to the patient. Then you provide privacy. Wash and dry your hands, and always wear gloves when providing mouth care. Assemble equipment like the MS's basin, the sputum mug, or then water, cup, toothbrush, toothpaste, mouthwash, and towel. To ensure that the patient is in an upright position for safety, a high sitting position prevents choking or aspiration. And if the patient is able to brush their own teeth, provide equipment and assist as needed. And this is an example of those that can be assisted. So wet your toothbrush and apply a small amount of toothpaste to the bristles on the brush. Hold the toothbrush for about 30-45 degree angle to the gum line. Brush one tooth at a time and in an up and down motion. Start from the top of the gum line and walk to the root, to the down of the teeth. Then start at the upper teeth and then complete the lower teeth. To bring biting surfaces, and so clean the biting surface of the teeth and tongue, use a back and a forth motion. Back and forth motion. So up and down for cleaning, then back and forth for what? The biting surfaces. So be sure to brush all surfaces of the teeth, gums, the tongue, and the mouth, and ensure the patient adequately rinses their mouth with clean water and dries their lips or faces. Offer mouthwash and lip moisturizer as needed and according to the patient's preference. Now, how do we perform this procedure for people who are unable to perform mouth hygiene independently as such patient is unconscious? The first thing we do is to complete hand hygiene and assemble the medical equipment. Then you put your patient in a side-lying position for safety. Then you turn their heads to the side. You place a towel or a waterproof pad under their cheek and their chin to prevent the patient or the bed linens from getting wet. Then you can place an emesis basin against the side of their mouth and their cheek. Emesis basin is that basin that they use to drain saliva or water from the mouth. Place a padded tongue blade on the side of the mouth to help their mouth open. To make a padded tongue blade, you can place two wooden tongue blades together, then wrap gauze over the top of half and tape it into a place. Then pull the patient's mouth apart by placing a gentle pressure on the chin and the upper mouth. Never put your fingers inside the patient's mouth because the patient may bite down if they do not mean, even if they do not mean to. So you brush teeth gently using a dry toothbrush or with a mouth swab. You dry the swab dip the swab rather in a solution and squeeze excess solution from the swab. Swab all surfaces of the teeth, the gums, inside their cheeks, the roof of their mouth, and tongue. And you use clean swabs as necessary. Rinse the entire mouth with a clean swab. Ensure there are no pooled secretions. Suction excess secretions directly as written in the care plan. Ensure the patient's mouth and face and the neck are dry. Then you apply moisturizer to their lips. Return the patient to a comfortable position. Lower the bed to its lowest height and raise the side rails. Put away equipment and supplies. Then remove your gloves, wash and dry your hands. Document the completion of the task and record any changes in condition or behavior. Remember to report any tooth or mouth conditions observed, such as sores, open areas, or bleeding from the gum, the tongue, or the teeth. And you can report any broken or missing teeth. Now, we move to the final procedure in this course, final procedure as it goes in this section, which is what? Denture cure. Denture cure. Now, to do a denture cure, the first thing you do is to complete your hand hygiene and assemble the needed equipment. Then you assist the patient to remove dentures if needed by placing a tissue, a gauze pad, or a washcloth underneath the patient's denture line, and then you gently pull forward, gently pulling forward to break the suction. Then you may need to gently rock the dentures from side or from forward to back to break the suction. To carefully place dentures in a water-filled cup or a container, then you tie dentures to the sink using a denture cup to prevent accidental breakage. Place the towel in the sink to prevent accidentally breaking dentures on the hard surface of the sink. While you are washing them, you can also fold them firmly. And you clean the dentures as you would clean the normal teeth. The dentures are the artificial, so you clean them as you would clean the normal teeth. Use dentures cleaning products like the warm water. You can use a warm but not hot water. Hot water can cause dentures to warp and no longer fit the patient correctly. So you rinse denture in a warm water and you rinse them completely. Provide or assist with mouth care prior to replacing. Then provide assist with mouth care prior to replacing dentures. Then you assist the patient to brush their gums and tongues with toothpaste and also a toothbrush. Ensure they rinse their mouth completely after mouthwash. Now, when you are returning denture to the patient's mouth, you apply denture cream or adhesive as needed. Assist the patient to place dentures back in the mouth. So reinsert dentures, insert at an angle, pressing firmly onto the gum line. If storing dentures, store them in clean, cool water in a container with a closed top to prevent accidental breaking or misplacement. And if in the facility, ensure the patient's name is on the denture cup to prevent loss. Remove your gloves, then wash your hand after the procedure is done. Then you dry your hand as well. Then after that, you document completion of task, record any changes in condition or behavior, report any tooth or mouth condition observed, and report if dentures are broken or if dentures are missing. And finally, the procedure for flossing. So flossing is using something to remove every food crumbs from the tooth. So if assisting with flossing, break off about 18 inches of floss. Wind end of floss, you wind the end of the floss around the pointed or middle finger, then wrap the other hand of it around the same finger on the opposite hand. Then you hold the floss tightly between your thumb and forefingers, starting at the top and the back of the mouth. Then you guide the floss between two teeth. Use a gentle rubbing motion to glide the floss between the teeth. Do not quickly snap the floss between the teeth, or you can cause pain or injury. Once you reach the gum line, you can cuff the floss into a C shape against one tooth for upper teeth. You can move the floss away from the gum line with a gentle downward motion against the tooth. Then the lower teeth. And for the lower teeth now, you can use the upward motion against the tooth away from the gum line. Then repeat for each tooth using a clean section of the floss for every 1 and 2 teeth. Then you allow the patient to rinse and dry their mouth, dispose of floss, and do not reuse floss. And this is an example of flossing, how flossing is being done. As this stops here at hot plates, so there is enough plates in between teeth. So with this, we have come to the end of this model. And we want to talk about 3 essential things, or 4 as it may be. We talked about teeth care and mouth care. And we talked about this for patients we talked about introduction, of course. Then we discussed how to do a teeth care or mouth care for a patient who can perform by themselves or that only need to assistance, and for those who are unconscious. And we also talk about the curing of dentures. And finally, we talk about flossing, how to do flossing. Thank you very much for your time and your listening. Enjoy the rest of your day. Bye.